Well, the month of May marks Mental Health Month, and today is World Maternal Mental Health Day. Now, the goal is to raise awareness for the mental health disorders women experience during and after pregnancy. Experts say most people suffer in silence because they don't know what they're experiencing is common and treatable. Today, I am joined by counselor Janelle Butler from Everyday Wellness, who is here to continue the conversation about this issue. Thank you so much for waking up bright and early for us.
Yes, amen.
Yes, amen. That's all we can say is amen. Now, one of the things I really want to dive into is the fact that a lot of women do suffer in silence. So many times we'll see folks saying, you know, I felt like I was the only one. I was embarrassed. I was ashamed. You know, I felt like I was a rare case when it comes to feeling poorly when it comes to my mental health during pregnancy. Can you speak to how common this is?
This is so common, and to not disclose too much, I have even endured this myself. And so I want to let you all know 1 out of 5 women are going to have some type of mental health issues while they're pregnant or shortly thereafter giving birth. And only about 20% of that 1 out of 5 will seek out mental health services, And so the rest of us kind of suffer in silence because maybe we don't know any better, maybe we're not encouraged to do better, maybe we're shunned if we do try to do better, or are made to feel a little bit ashamed because, oh, they're just baby blues. You know, we all, you know, you'll be fine.
And that's not the case always.
That is not always the case. Not always the case.
So speaking about baby blues, how do you tell the difference between baby blues and postpartum depression, postpartum anxiety, even depression and anxiety during pregnancy?
Absolutely. There's some telltale signs to really look for. You're not just kind of just upset or maybe frustrated with the change of life or the change of pace. Obviously, we all go through the change because having 1 child changes your life. Now, having 2 or more change how you do life. That's a whole different conversation. But, you know, when you have a child, your whole life is going to shift. So it's natural for you to feel overwhelmed at times. But the duration, the extent of that, when you have lost interest not only in things that you once enjoyed, but also in people and possibly in your newborn child. If you have changes in your appetite, in your sleep that are outside of the norm of what society and what medical practitioners would say is normal for someone who is pregnant or just had a baby, that is something to look at. If you are becoming more of a recluse, not engaging even in normal activities, you're seeing an increase or even the development of suicidal ideations or self-injurious behaviors. These are things to look at and not just simply pass by.
Right, don't brush it under the rug. Now, where can people get help? What are resources that are out there?
Definitely, you want to check in with your doctors, see what providers are out there available for mental health. You want to be open and honest with yourself, with your support system, and with the practitioners who are working with you. But there are also support groups, even looking online for postpartum, for those who are pregnant. A lot of my go-to is Psychology Today. I will type in very quickly psychologytoday.com. I will look for some groups for specific needs, but there is camaraderie and healing a lot of times in groups. So I encourage moms who are pregnant, those who just had a baby, to look for support groups.
Absolutely. And we have about 20 seconds, really, really quick. Can you tell us about what we can do as a support system to help?
Okay, watch what you say. Words are powerful, people. Words are powerful. When you say, oh, it's no longer about you, it's about the baby. Oh, how's the baby? And we're not asking about the mom. You good, sis? Ask about the mom.
Man, Janelle,
ask about the mom.
Thank you so much for joining us this morning. And I'm praying that all our mamas who are listening out there know there is never shame in getting any help.